Hi, this is Makoto Tamai, a Japanese hand surgeon. I'm talking about anatomy of the proximal carpal row, that is one of the skeletal components of the human wrist joint. As generally recognized, the proximal carpal row is an important component for the function of the wrist joint. However, it also highly associates with many disorders, including several most problematic conditions of the wrist joint. The proximal carpal row that consists of three proximal carpal bones, scaphoid, lunate, and triquetrum, is set between the radius and the distal carpal bones and forms the radiocarpal joint proximally and the midcarpal joint distally. Consequently, the proximal carpal row works as an adapter to connect two joints with different morphological and mechanical properties and mediate a proper relationship between the radius and the distal carpal row. Anatomically, as such a bone that sits between bones and modulates a complex motion is called an intercalated bone. The proximal carpal row is also called the intercalated segment. This term is frequently used in clinical diagnosis of an abnormal condition of the wrist joint, such as the intercalated segment instability, that is produced by bony or ligamentous injury of the wrist joint. And the BC or the DC appearance represent malalignment of the bones continuous from the forearm to the distal carpal row that may cause problems onto the wrist joint, including secondary osteoarthrosis. The proximal carpal row is formed by connecting three proximal carpal bones using interosseous ligaments. The scapholunate interosseous ligament that connects the lunate with the scaphoid consists of a dorsal ligament, a palmar ligament, and a proximal membranous portion. These constructions are similar on the lunotriquetral interosseous ligament that connects the triquetrum with the lunate. The dorsal scapholunate interosseous ligament can be observed by removing the dorsal synovial capsule, but the lunotriquetral interosseous ligament is hidden behind the dorsal capsular ligament. The palmar interosseous ligaments are also hidden behind the thick palmar capsular ligaments and can be observed after removal of these ligaments. The proximal membranous portion of the interosseous ligaments seem to indirectly conjoin with carpal bones mediated by cartilage and help create smooth conjunctions between the scaphoid and the lunate and between the lunate and the triquetrum. The distal carpal row consists of four distal carpal bones firmly connected by interosseous ligaments, and there is little movement among their joints. However, the interosseous ligaments of the proximal carpal row are somewhat loose, so as to allow some movement between the scaphoid and the lunate and between the lunate and the triquetrum. The proximal carpal row is set between the radius and the distal carpal row and connected by capsular ligaments that exist buried in the surrounding wrist joint capsule. The dorsal capsular ligaments include the dorsal radiocarpal ligament that connects mainly the dorsal aspect of the triquetrum with the dorsal rim of the distal radius. The dorsal intercarpal ligament covers the midcarpal joint and attaches several carpal bones, but mainly connects the triquetrum with the scaphoid. There is also a separate bundle that connects the triquetrum with the scaphoid, and it is named the dorsal scaphotriquetral ligament. The dorsal scapholunate and the dorsal lunotriquetral interosseous ligaments exist just proximal to this dorsal scaphotriquetral ligament. The palmar capsular ligaments are classified into three groups: the radiocarpal ligaments that connect carpal bones to the radius, the ulnocarpal ligaments that connect carpal bones to the ulna, and the intercarpal ligaments that connect carpal bones together. All these palmar capsular ligaments attach on the bones of the proximal carpal row, directly or indirectly. The radioscaputate ligament contains two significant bundles. One bundle connects the scaputate to the styloid process of the radius. It doesn't have a direct attachment on the scaphoid but sticks on the ulnar side of its distal pole via joint capsule. Another bundle that runs over the midcarpal joint interdigitates with the palmar scaphotriquetral ligament and connects the triquetrum to the radius. Some researchers include the radial collateral ligament as a part of the radioscaputate ligament, though it cannot be included in the palmar-capsular ligaments because it can be isolated by anatomical dissection on the radial side of the wrist joint. Except for this ligament, sometimes a tiny bundle that directly connects the ulnar aspect of the scaphoid tubercle with the radial side process can be found. The long radiolunate ligament is a significant ligament that connects the lunate to the radius, but this ligament also contains two bundles. One bundle connects the lunate to the radius and another bundle connects the triquetrum to the radius. The palmar scapholunate and the lunotriqueter interosseous ligaments exist under these palmar radiocarpal ligaments as shown before. The short radiolunate ligament is hidden behind the tan-like sickling of the joint capsule that was suggested by Dr. Taresnik to adapt the name distal extension of the palmar radioulnar ligament. The short radiolunate ligament connects the proximal portion of the lunate just palmar to its articular surface with the palmar rim of the lunate facet of the radius. Two bundles of the ulnocarpal ligaments attach on the bones of the proximal carpal row. The ulnolunate ligament or the ulnotriqueter ligament connect palmar proximal portion of the lunate or the triquetrum with the base of the styloid process of the ulna, respectively. The left ulnocapitate ligament does not attach on the proximal carpal bones, but it is hardly separable from other two ulnocarpal ligaments because, as mentioned by Lewis in 1970, these three ulnocarpal ligaments have lost their separate identities in the human wrist joint. There remains a controversy about the existence of the ulnar collateral ligament in the human wrist joint. However, a second fibrous capsule between the ulnar styloid process and the triquetrum can be constantly observed. Even though it looks less significant than that of gorilla, it can be called using the same name. Among the palmar intercarpal ligaments, the palmar scaphotriqueter ligament that connects the triquetrum with the scaphoid is arranged parallel to the dorsal scaphotriqueter ligaments and helps constructing a cradle for the proximal condyle of the distal carpal row. The palmar lunotriqueter ligament connects the triquetrum with the lunate, but it contains a bundle that connects the triquetrum to the radius, as I have shown before. Regarding the naming of this construction, a classic description of radiolunotriqueter ligament seems to be proper. The scapotrapezial ligament, the scapocapitate ligament, or the triquetrocapitate ligament connects a bone in the distal carpal row with a bone in the proximal carpal row. Pisiform is hanging from the hook of the hamate and the base of the fifth metacarpus and joined with the triquetrum, but there is no ligament connection between the pisiform and the triquetrum. Generally speaking, movements of joints are measured or evaluated by the projection of an extremity onto the anatomical planes that are embryologically and geometrically defined on the human body. Thus, the movement defined on the wrist joint are flexion and extension on the sagittal plane and radial and ulnar deviations on the coronal plane. In these motions, the scaphoid has an important role to work as a crank to rotate other two bones in the row to adjust their adaptability to both the radius and the distal carpal row, maximizing mobility without sacrificing stability of the wrist joint. For example, on my wrist joint, during 120 degrees of sagittal motion from flexion to extension, the scaphoid or the lunate dorsally rotates 75 degrees or 45 degrees to the radius. And as a result, to obtain 120 degrees of arc of sagittal motion, the capitate needs to rotate only 75 degrees to the lunate. During 50 degrees of coronal motion from radial to ulnar deviation, both the scaphoid and the lunate dorsally rotate about 25 degrees on the sagittal plane and radially translate 8 mm on the coronal plane. To obtain total 50 degrees of coronal wrist motion, the lunate rotates 25 degrees to the radius and the capitate rotates 25 degrees to the lunate on the coronal plane. Thus, the proximal carpal row helps to enhance the mobility of the sagittal and coronal wrist motions, and it must be beneficial for human life. However, when look at the human daily activities, we will find most wrist motions and positions are not simply following on the sagittal or the coronal plane. It is said that the motion that human wrist joint most performs in the daily activities is the dust throwing motion. In the several historical namings, I'd like to pick the most popular one. The dust throwing motion represents the movement of the wrist joint from radial extension to ulnar flexion, and it is well known as a motion that can minimize the movement of the proximal carpal row. During the dust throwing motion of my wrist joint, 35 degrees rotation of the capitate makes the scaphoid and the lunate rotate less than 5 degrees on the sagittal plane, with a less than 3 millimeters of radial translation on the coronal plane. How it can be possible? When the wrist joint is flexed, the head of the capitate primarily hits the medial cortex of the scaphoid and makes the proximal carpal row rotate palmally. However, if the forearm is supinated about 30 degrees, the capitate does not hit the scaphoid, and consequently, this can minimize the rotation of the proximal carpal row. By these reasons, application of the dust throwing motion into hand therapy is considered to obtain area functional recoveries in the treatment of wrist problems, including the scapholunate interosseous ligament injuries. But it seems difficult, because it was reported that the dust throwing plane is different from person to person. The functional plane of the dust throwing motion, which is observed in the daily activities, is different from that of pure dust throwing motion. Rotation of the scaphoid and the lunate can be minimized, but still be observed during the dust throwing motion, and the dust throwing motion may cause more stress on the scapholunate interosseous ligament. For example, in the full range of dust throwing motion of my wrist joint, scaphoid started palmar rotation at the point of 20 degrees of ulnar flexion. This shows that the safe range is limited, so further investigation is needed to find out its values for treatment or training methods. When thinking about the evolution of anatomy and functions of the wrist joint, a hypothesis that the dust throwing motion might contribute in developing tool handling in humans brought us one question: whether the dust throwing motion is unique to humans. I think the answer is different according to the definition of the dust throwing motion. When we look at the quadrupedal animals, their wrist joints look moving on dust throwing fashion. Basically, the skeletons of their forelimbs are set pronated that look just like the posture of human forearm during the dust throwing motion. This fact may provide explanations for the carrying angle of the human elbow joint that is straight in pronation, and the pronated pisotriquetral joint that suggests that the motion perpendicular to this joint is an essential motion of the human wrist joint. Biomechanically, the dust throwing motion has a benefit to produce efficient power. By setting FCR and ECU muscles that have tendencies on their proximal carpal bones as stabilizers of the proximal carpal row, using powerful ECR and FCU muscles as power source, and using longer and centralized lever arms to obtain greater mechanical advantages. From these points of view, it is considered that the dust throwing-like motion might be a fundamental motion of the wrist joint that all mammals inherited from their common ancestor. On the other hand, each animal species might have unique constructions of wrist joint and use different mechanisms to produce dust throwing-like motion. For example, animals of carnivora like lions have wrists that the scaphoid unites with lunate and forms the scapholunatum, and the scapholunatum possibly performs a dust throwing-like rotation by itself. Even in the primates, movement of carpal bones of monkeys that own the os centrale in their midcarpal joint and also keeps the ulnocarpal articulation might be different from that of humans. From these points of view, it can be said that the dust throwing motion produced by human anatomy may be a peculiar motion to human wrist joint that hold well mobile and fragile proximal carpal row. I hope I could provide some new idea about the anatomy and functions of the proximal carpal row. Thank you very much for your attention.